Have you been told that you have a cyst or a growth on your kidney? If so, you're not alone. We see tons of people who have growths on their kidney, and part of the reason is that these days CT scans and ultrasounds are so easily performed that many times we get referred patients who have these growths on their kidney because they had a CT scan for another reason. When it comes to growths on the kidney, the way to maybe conceptualize it is that it's a spectrum of things that can grow on a kidney. On one end of the spectrum would be a solid mass that could be concerning for a kidney tumor. On the other end, it could be a simple cyst, which is essentially just a water balloon on the kidney. But in between the two, you can have complex cysts. And the more complex a cyst looks, whether that is a thickened cyst, some solid components within the cyst, etc., the more complex it gets, the increase the risk of cancer. So that solid end of the spectrum can have a risk of cancer of about 80-90%, but in that water balloon end of the spectrum, it's essentially less than 1% risk. But if you have a growth or a cyst on your kidney, make sure you see your doctor or get an opinion from a urologist.